So yes, here with Dr. Gemma Pearson, a veterinary behaviourist, just to have a chat about your talk that you did yesterday. So is it okay if you just, for our audience, kind of go over as best you can? It was a very detailed and informative talk, but if you just go over some of the key points that you went over yesterday.
Yeah, so I guess lots of people come to me, particularly equine vets, and they say, we've got this problematic behaviour in this horse. I need to know, is it due to pain or is it a behavioural problem? And I'm trying to get across to people that that's asking the wrong question, because it makes it sound like it's a binary concept. It's either pain or it's behaviour, and it's not. So the way I approach these cases is I look for evidence for cognitive, emotional and physical pathology. So 3 different areas where we can think of pathology, and then what evidence do we have in each one? And then once we've got that, then I treat them all. And this is where we talked about in people, they've moved from, so traditionally, if you were in pain, you would go to your doctor and they would either give you some medical treatment, usually some pills, or you may have surgery to resolve something. But lots of things we can't fix. So if you've got a horse with a foot abscess, I have a horse with a foot abscess at home right now. It's not very helpful when I'm on the other side of the world, but I am confident that that hoof will be returned to 100% normal function. But if we have a horse with arthritis, then that, those joints are never going to return to what they were when they're a young, healthy horse. And it's the same with people. As I'm getting older now, you have these little niggles, you're not going to go back to having the same strength and suppleness and joint health and everything else when you're younger. So we have to learn how to manage with minor pathology. And we can still have a brilliant quality of life with mild pathology. So that brings into the fact that how you feel has an impact on your perception of any low-grade pain. So then when we get into treatment, we talk about the biopsychosocial approach to treatment. And that is where, again, it's all come from working people, whereby, we look at the biology, the physical factors, but we also look at the social factors and the psychological factors. So the social factors are what support you have from friends and family, how other people react to your pain, and then the psychological factors, you may be aware of cognitive behavioural therapy, where people learn to cope with their pain and they learn different coping strategies. Because if you say you have some lower back pain, if you start thinking about that lower back pain and you start getting quite depressed about it, you then are driving a stress response which actually tells your body to look for potential threats, and it goes, well, you've got lower back pain, that might be a threat, and it gets this vicious cycle. Whereas if people can learn how to have alternative thought strategies and alternative behavioural responses, then they stop thinking about it, and actually then they learn to cope with it better. So I don't know if that was a very short overview, but hopefully we've covered some of the main points.
No, definitely. And I think the most important part of your talk was the individuality of experiences and coping, which I think sometimes when we see a one-size-fits-all approach, that's really where things go wrong. And as you have these 3 components and you take in that individual and those 3 components, and then you create your, obviously I know there's a little bit more than that as well, but you're really creating an individual kind of plan for that horse. So could you just go through roughly kind of maybe like an example you gave yesterday of what that plan looks like and how to apply it?
Yeah, so that's where, as I was saying, it'll often take me an hour to take a history from my cases, because of this fact that we're not just looking at the pain aspects or the unwanted training aspects, we're also looking at other parts of the horse's life and how they impact on them. So for lots of my cases, I will be looking at how the horse is kept, whether it has good access to friends, forage and freedom, its early life experiences, how they're impacting on it. And then when we come up with a treatment plan, we're trying to address all of these areas at the same time. So there was a case that we looked at in the video with complex regional pain syndrome, and that was something that it's a recognised complication post-surgery. It happens in people. It's more likely to happen in people if they're stressed, and then when they're stressed, they can get this burning sensation at the surgical site. So this was a mare that was kicking out and was clearly distressed many, many weeks down the line after surgery, and the surgical site had healed beautifully. So we said, okay, well, we need to, there's nothing physical to treat there, but we are going to put her on some amitriptyline, which is a psychopharmaceutical. It's a drug that reduces anxiety, but it's also good for treating some of the pathways for chronic pain. Then we thought about, what about her social life? So we made sure that she was in a paddock, so she had access to freedom of movement, and that she could groom other horses over the fence, because she was in a veterinary hospital, so she wasn't going to be put in the same paddock as There's horses she didn't know. We got the grooms to spend some time really grooming her neck. That activates the parasympathetic nervous system. That's going to promote healing. And then we also thought about doing some lunging with her, so there was an outlet for some of that stress response to go. Obviously she was on ad lib feed. And then we had the behaviour modification programme of classically counter conditioning her, because for this mare it was actually she could cope with the weight of a rug on the surgical sites, but it was as soon as they were taken off that she got distressed. So we just changed her thought processes around this rug being taken off, as well as looking at all the other aspects of her life, and she went back to being able to live with no rug on and being ridden and being happy again.
Definitely. I loved listening to that case, and I think as well that really highlighted the importance of working as a team, and as you had your graph that you had saying about veterinary behaviourists, a qualified behaviourist, and a vet as well. Was it a vet on the side?
That was another case, and that's one that I saw that's geographically very far away from where I live. And the lovely Leanne Preshaw, who's a non-veterinary behaviourist, was able to go in there and work with the owner on a regular basis. And me, Leanne, and the vet that normally treats this horse have a WhatsApp group, and we discuss this case on a frequent basis. And certainly any problems come up, sometimes we'll have Teams meetings, and we're getting all three of us to sit down and say, well, from my perspective, these are, what we need to be considering and where we might go, and then so as well, this is what I think, and so it's really having that team approach to getting on top of these cases.
Definitely.
And as you say, they're all individuals, and that's really key for behaviour, because in many aspects of veterinary medicine, say you wanted to develop some magic cream for wound healing, you would have lots of wounds, and you would say, right, well, some we put the cream on and some we don't, and what difference do we see? And that's lovely science. But when it comes to some, when horses develop behavioural problems, so many individual factors in terms of their current life and their previous life experiences and how their body responds to pain, and there's so many different things that come into it that you have to have an individual tailored plan for each one. And that's where having that team approach, they know the horse, but they know them from different perspectives. It works. Definitely.
And just lastly, what do you hope people took away from your talk?
Oh, those are always the hard questions.
I know.
I think it is not asking, is it pain or behaviour, but saying what evidence do we have for cognitive, emotional and physical pathology, and then looking at the horse as an individual and treating it accordingly.
Wonderful. A great final point. So thank you so much.
Thank you very much.